All right. Hi. Welcome, everyone. Sorry we're having a few technical problems here. I'm Andrew Penn. I'm one of the co founders of OPENurses, and it is my distinct pleasure to welcome my friend and colleague Josiah Laughlin. Josiah Laughlin is a recent graduate of the OHSU School of Nursing and is in year one. In fact, he's in finals week this week, so it's extra special that he's taking this time with us. Year one of three in his Doctor of Nursing Practice, DNP, psychiatric mental health nurse practitioner program at OHSU. He works as a floor nurse in the Portland VA Medical Center in the acute inpatient psychiatric unit. Josiah is also a member of the Social Neuroscience and Psychotherapies, or SNAP Lab, which is currently investigating the therapeutic potentials of both MDMA and PTSD, and also psilocybin-assisted psychotherapies through the Portland VA. He lives in Portland, Oregon, which is a hotbed of all things psychedelic these days, and lives there with his wife and three dogs and enjoys running, jujitsu, and traveling. So, want to welcome Josiah on the screen here and invite those who are watching live to um, go ahead and put in where you're watching from into the chat. That way we know who's out there in the audience, and later on we'll have a chance to ask Josiah your questions. So, Josiah, welcome.
Hey, Andrew, it's good to be here. Thanks for having me.
Yeah, glad you're here. Sorry about the slow internet. When it rains in San Francisco, everything shuts down. You would think we would have good internet here, but you would be wrong. Um, so Josiah, I think it's probably a good time to tell the story here of when I first met you was through I got introduced to you from our colleague Lydia Bartholomew, and I was meeting up with her and and you sat down at the table, and I was like, who's this really clean cut guy? And then I started noticing your hands, and you had these great tattoos on him, and I thought, this guy, there he goes. Like, this guy's got a story behind it. So I would love to know. We always start these off with, how did you get here? What was the trajectory of your nursing career, and however did you get involved with psychedelics?
hmm Yeah, I remember that dinner, and big shout out to Lydia. She's one of my heroes in this space for sure. So my route into uh, nursing is pretty atypical. I was actually a tattoo artist for 20 years prior to becoming a nurse, and in 2017, I decided to go back to school after taking a hiatus for a good 12 or 15 years from academics. And I wasn't really sure what I wanted to do. I knew I wanted to do something in service, public health, something like that. I had the idea that maybe I was going to be a paramedic firefighter or something along that lines. And while I was in school and with the training of it all, it just wasn't gelling for me. It wasn't really what I was expecting it to be. But along the process of being in school and kind of exploring these new potential career paths, um, I had the opportunity to do a rotation in an emergency department with some nursing staff, and that was when the light bulb went off, and I was like, "Oh, I'm going to go be a nurse." And that was really kind of the initial steps for me to start pursuing nursing. I started volunteering at OHSU and at the VA. And doing all my prerequisites for nursing and getting ready to apply. And luckily, I was able to get into OHSU's 3-year BSN program, which was just a spectacular opportunity for me.
Wow. So, and how did you get involved with the psychedelic side of things? Like, what was the impetus for that?
So that's an even longer story. So
Oh, it's okay. We've got an hour.
great. So part of my backstory prior to becoming a nurse is I've been in recovery from substance use disorders for I just celebrated 12 years. So
Congratulations.
I prior to exploring becoming a nurse and pursuing this career path, I was involved in 12-step and some Buddhist recovery groups, and then Buddhist and yoga groups, and part of those systems involves service work. And so I was volunteering with some homeless services for youth and adults, and I was going into in AA, they call it hospitals and institutions. So basically, I was taking AA meetings into detox units and jails and treatment centers. I had previous experience in my teenage years with psychedelics, and some of them were quite wonderful, and some of them were really challenging and difficult and unpleasant. And they really scared me when I was a young person. And, so this is 25 years ago, 20 years ago, when that all took place. And there were no, there was no fireside. There was no integration groups or psychedelic societies that I was aware of in central Minnesota, where I grew up. So those experiences were really, really tough for me. The way I got into psychedelics now is they started to kind of bubble up, around 2015, 2016. I started hearing more and more, in podcasts that I listened to, or, you'd read an obscure article somewhere in a magazine. And so I started kind of, well, what's going on with this? And I knew about a lot of what had happened, 50 years prior. And in that, kind of just slow exploration, I started to notice more and more of the research that was starting to be published, particularly in relation to, addiction management, behavioral issues, such as substance use disorders, or, or whatever we would like to insert there that can cause problematic behaviors. And then I started to meet some people that were in the recovery space that were open to using psychedelics. And so that really kind of started to shift my perspective. I kind of came up in this 12-step regimented abstinence or nothing. It's all drugs. It's not medicine. Stay away from it.
Right.
And the data started to change my mind. And so I thought, there might be something to this. And so, got really interested in the research side of this all.
Well, and there's that whole backstory about how, Bill W. had belladonna treatment back in the 30s when that was, that idea of invoking delirium, and people, sort of DTs was aversive enough that they would stop drinking. And then he had his LSD experience, but that became not a part of the 12-step tradition. So I'm curious, I've certainly encountered that attitude that you describe among people in recovery, where sort of all drugs are sort of seen in the same light, and seen as potentially, maybe if not equally harmful, at least have equal potential for harm, or equal potential for losing control over. And I'm wondering if you could talk a little bit about that, because I imagine, we know that nurses have high rates of substance use disorders. It's probably a reflection of the difficulty of the job. And we know that there's a lot of nurses who are in recovery. And so how does that square for you? And how have you been received among your recovery community for having this interest in psychedelics?
Well, I think, I love that you brought up Bill W., because that's like the biggest little piece that they love to, don't look at that. Don't look at that.
Right.
In all the recanting of the founders and their glory. It's we're not going to look at that part over there, though. Let's focus on this. So, that was a huge part of his story, and as it was recently quoted, psychedelics were the darling of psychiatry in that era. So Bob Jesse said that, just to make sure I'm quoting the right person. And that was kind of the thing. And then, what we saw when they got out of the lab and into the culture and the counterculture, and then we all know what happened from there. As far as the recovery community is concerned, the majority of people that I've met in the recovery community that know what I'm doing and know that I'm a part of this research lab are very supportive, and they're very interested, particularly here in Portland, Oregon. I think it would be a different story if I was back in the Midwest in my hometown, where things tend to be 10 to 20 years behind everywhere else.
Mhm.
But there's a lot of support. Again, big shout out to Lydia Bartholow, who she has been so instrumental in changing helping me expand my perspective on substance use, and understanding that it can't be binary of abstinence or full tilt um, addiction.
Mhm.
It's a spectrum, and
Mhm.
people fall into different areas of that.
Yeah, and it's interesting because what you're talking about is really a both and perspective. Where I think when I think of 12 step, and this is maybe my own ignorance speaking here, but it feels like it's very much an all or nothing. You're either
Mhm,
sober or you're not, and if you're using, you're not sober.
mhm,
And so what you're really suggesting here is that there's room for both and.
mhm. Yeah. So what we're seeing lately, with the fentanyl crisis,
Mhm.
is um, you know, with 12 step for a long time, there was a lot of hesitancy and rejection of medication assisted treatments. So things like buprenorphine, and such. And, there was a lot, just even antidepressants were rejected. And I've heard
Mhm.
that come out of the mouths of members. And with the rates of overdose that we're seeing now, we can't, that's just not a sustainable option for people,
Mhm.
that really all or nothing attitude, you know, leads to fatal consequences a lot of times. So we
Mhm.
need to kind of start addressing this in more of a, kind of a spectrum based approach, where, sometimes that happens, and we want to keep people safe and keep them alive.
Mhm. Yeah, don't let the perfect be the enemy of the good, right?
Yeah,
Um,
right.
but so when I think about some of the other work that you've done, as a nurse, but also as a community organizer, and we're gonna definitely putting a pin in that one because I want to come back to the work that you're doing with PICO. But I'm wondering, do you feel like nurses bring a different perspective to the psychedelic work than maybe some of our colleagues? Is there something about nursing that is different?
Yeah, for sure. You know, we are nurses have this unique um, skill set that we
Hmm.
carry with us. We walk in many different worlds. We can be on the floor with patients for up to 12 hours a shift. In oftentimes in very intimate circumstances, we are seeing people throughout all the ups and downs of their lives, from their greatest triumphs to their final moments in this realm. So and everything in between. So I think we have that connection with people that you can only have from being on a floor for the amount of time that we're on it with the patients that we're caring for. Um, and also with that, we are great translators. We communicate what providers and other disciplines that we collaborate with on a unit. We take what they're telling the patients, or they tell us, and then we transmit that information to patients and families and other people, you know um, and that can expand from the individual to a family to an entire community and a population. So
Mhm.
we're really good and equipped at that. So I think that that's definitely one of the assets that we bring to this work.
Yeah, and that kind of it connects to some of the work that you're doing outside of the hospital, with regards to nurses being good communicators of health information, and nurses being, when your kid is sick, you call your friend who's a nurse and ask them what you should do, right? You've had those calls, I'm sure. Um,
Mhm.
and it gets me thinking about, how do we communicate this about this information? You're living, of course, in Portland in Oregon, which is ground zero for all things psychedelic. Nowadays, we
Mhm.
used to think we were cool here in San Francisco, but we've totally lost our crown to you all up there in Oregon. um, so what's your part in communicating the information around psychedelics to people in your community as a nurse there in Oregon, where lots of people are probably asking questions?
Yeah, that's a big one. Also, I would like to say for Oregon, we also decriminalized personal possession of all substances. So we are at the tip of the spear on a few different fronts here, and it's an interesting time to be here in Oregon, and then b
Yeah.
also be a nurse, trying to keep the public informed and as safe as they can be. You know, so I think right now my role personally as a nurse is, trying to make make connections within the nursing and healthcare community with, um, policy and,
Mhm.
advocates for Measure 109, and then also to transmit this information and educate a population that's pretty psychedelic naive.
Mhm.
I was at a dinner, a few months ago with, my wife and some friends, and their comment was, "Oh, I watched that Michael Pollan show on Netflix, and shrooms cure OCD after one dose."
Oh, Michael. Yes, right. Yeah.
And I think that is a really accurate representation of the general pop,
Yeah.
and what
Yeah.
their perspective on this is. So we need to, approach like nurses do with the skill that we bring in teaching, where we have this way of assuming that a group or a person has little to no information or understanding about a thing, and then we communicate it in a way that's not condescending or,
Mhm.
you know using language that the person doesn't understand, and then they maybe get confused or frustrated. So I think that's one of the most important roles nurses have to play in the psychedelic space right
Yeah.
now,
Yeah.
especially here in Oregon.
So for people that are not living in Oregon and may not be as conversant about what's going on, what Initiative 109, that's the voter passed initiative that said that people can set up psilocybin service centers, I think is the right term,
Mhm.
in Oregon, and that's a place where you can go to have a psilocybin experience, but you don't get to take it home. It's not like a cannabis dispensary, right?
No, 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 no. You have to go to a licensed service center. The psilocybin will be administered by a licensed facilitator,
Okay,
and then you are to remain on site until the end of your journey or your session.
so it's like getting your wisdom teeth out or something. Maybe that's a
Yeah,
poor.
yeah, maybe.
You can't leave until you wake up and you're clear headed. Um, So and also to be clear, this doesn't have to be for a medical condition or a psychiatric condition. This can be, I've always wanted to try shrooms and now's my chance.
Yep, yep.
Okay.
So yeah, this is open access. You don't need a medical diagnosis, like we did with medical cannabis. Um, you come in and you have a screening, and you are eligible to receive services if as long as you meet certain criteria.
And do you know what that criteria is yet? Has that been published?
Yeah. So the latest is, I think, one of the some of the criteria that make you ineligible for a service, or you can't be on lithium, you
Hmm.
can't admit to being suicidal or homicidal, um,
Hmm.
and you can't be under the influence of any other substances. And I think there's a bit of facilitator service discretion where they have the right to refuse.
Okay.
Yeah.
Because the people who are doing the sitting are not necessarily licensed clinicians, right? There's a the level of training has been intentionally lowered to make it more accessible, is my understanding from this California perspective. But tell me if I've got that wrong.
No, you are correct. So with the facilitators, the people that will be sitting with the people while they have their psilocybin experience, um, they undergo a Oregon approved training program.
Okay.
Um, I don't know what the requirements are for hours, but they go through this program and then they take a test and then they get a license from the Oregon Health Authority that
Okay.
allows them to be a facilitator of a psilocybin experience.
Okay.
Um, you don't have to be a clinician or have any background there, although I do think there are clinicians and other people of different backgrounds, but their licenses do not transfer into that. You are solely a licensed psilocybin facilitator in that scenario,
Okay.
not MD or a PsyD or anything like
Got
that.
it. So if I'm a nurse practitioner in Oregon, that doesn't automatically make me qualified to give somebody psilocybin. I would have to go through this training as well.
Yes, that is correct.
Got it. Okay. And so, for people, so I'm curious, you're at that dinner party and, it's so funny because 10 years ago, it used to be kind of hush hush, right? People wouldn't talk about these things. And now I feel like I can't get away from people talking about psychedelics. And, maybe this has to do with my job, right? I give people psychedelics too for, a living. And so people have lots of questions and want to hear about it. But, are there things that if you were having that conversation over the dinner table or over the back fence and a neighbor were to ask you what are the things that you would be advising people to be thinking about as they if this was the first time they'd had a psilocybin experience and they were interested in pursuing this has always been a bucket list thing, Josiah. I've always wanted to know what it's like, and now there's this service center down the street and I think I'm going to go try it out next weekend. What would you advise people in that role? What do you think they should know?
Well, one would be temper your expectations of what this experience could be, and two would be, understand that this is not a panacea. It's not a cure all. This is although I'm excited that our um, our policy of substance use and the war on drugs, that's a whole nother topic, that these things are starting to change. There are some potential risks involved with having these experiences and using these substances, and being as adequately informed and aware of these potential risks is important going into this session. And I don't mean to say that to scare people. However, they need to know these things so that if something comes up during their experience, they can go, oh, that's right, I read about this, someone told me about this, I was aware something like this might happen. I'm going to go back to my
Mhm.
breath because I learned how to do some breath work and meditation prior to having this experience. I'm going to fall back on that.
Yeah, absolutely. That makes sense. Um, yeah, I want to encourage people who are watching from home to feel free to put questions in the chat, and we'll try and get to those. I really appreciate that you said expectation management and tempering expectations, because that is one of the aspects of the what we sometimes call the pollen effect in our lab. I think other people have called it that too, where it's really that idea like, oh my gosh, I took these one time and it cured my OCD, and as much as that would be great, it seems like the reality might be a little more modest, and how do we navigate that so we don't get, so people don't get crushingly disappointed when all their problems don't go away after one dose of psilocybin. We love the miracle cure, don't we?
Yeah, yeah,
Yeah.
definitely. And I think with my involvement in the SNAP lab, you know, we are recruiting people out for the psilocybin for methamphetamine use disorder investigation.
Okay.
The participants of that study are coming from a residential treatment program.
Oh, interesting.
The medical director is a dual certified NP, Jeff Osborne, um, and the participants are coming from that program, and so it's not just that we're going to give you psilocybin and then poof, your meth use disorder is going to
Right.
miraculously disappear.
Right.
There's a ton of work that goes in prior to that. There's work that goes in after each session. There's follow up. There's continuation of care as they leave that service center and go into the outpatient setting. Um, it's important to understand, with any uh, therapeutic process, that it's not going to be a one hit wonder and then you're
Yeah.
you're on your way and everything's fine. And I know that's a bit on the farther end of a spectrum, looking at psychotherapeutic uses of psilocybin. But I also think there's a lot of people that are like, I've had this thing that's been bothering me for 20 years, and I think
Hmm.
that psilocybin could potentially help me with that. Well,
Hmm.
it's possible, and there's other support mechanisms that might need to be in place in order for that to be as effective as people want.
Right. Yeah. Um, yeah, because of course people are often still living in that environment where they're using, and there's lots of cues and lots of
Mhm.
and and unless it's addressing their underlying reasons for why they're using, um, it may not create that shift that you're talking about.
Mhm.
So you, Josiah, in many people's estimation, are living the dream. You're working as a nurse. You're an NP student at OHSU, but you're also doing research, which a lot of people. You and I are both researchers and get a lot of inquiries about, like, wow, how did you get into that? But I'd love to know. You mentioned the methamphetamine study that you're doing. Could you share more with us about the other things that you guys are researching at the Snap Lab?
Yeah, of course. Yeah, for sure. And I'd love to tell you about how I got into the SNAP lab too, because
Yeah, and I would
it's
love to
fun.
know what your role as a nurse there is, because that's another question I get asked a lot, is like, how can nurses do research in this space? And so it'd be great if you could share that too.
Okay, I'll go in order.
Okay.
So currently we have one investigation that's in progress, and that is for the psilocybin for methamphetamine use disorder. Um, and then we are about to start our MAPS trial for MDMA assisted group therapy for
Mm.
post traumatic stress. I think that's getting ready to. We're going to start recruiting for that next month, so that's really exciting. And then we were just approved to do a MDMA assisted therapy for PTSD in gender diverse, gender non-conforming
Oh, wow.
population. Yeah, so that's we're not ready to recruit for that. That the approval just came through for that, but it's looking like that's going to be happening here within the next year. And then we're also looking to do finally we're looking to do a ketamine investigation for ketamine assisted psychotherapy versus ketamine infusion therapy. So there's
Oh,
not
okay. Okay.
there not a lot of publishings on that yet. So hopefully we can
Yeah.
get a pilot study going here soon.
So for depression with the ketamine study?
Yeah, so our VA clinic is looking to open a ketamine infusion clinic for treatment resistant depression and acute
Mhm.
suicidality, and
Okay.
so yeah, we're looking at some different protocols that to see what would be most effective for our veterans here.
Yeah, that's one of the most interesting uses of ketamine that I mean, ketamine's become so common now that it's hard to believe that it
Mhm.
wasn't that many years ago that it was kind of exotic. But this idea that, could ketamine be sort of like oh, what's the drug that you give somebody if they've just had a stroke? TPA, the sort of the equivalent of TPA. If you've, you come in the emergency room and you've just started having stroke symptoms, you get TPA, right? If you come into the ER and you're acutely suicidal, could you get ketamine? And I know that that's been studied, but it really, I think it's one of the under utilized potentials of that drug. So that's great that and that would be a comparison against, so ketamine infusion versus ketamine assisted therapy. Would that be sublingual or IM, or what would be
Intravenous.
Oh, intravenous. Okay. So
Yep.
intravenous
That's
both ways, but in one, the person gets
yep.
therapy. The other, they just get the drug.
Mhm. Yep.
Interesting. Okay. Same dose for both, I assume?
Yep.
Okay.
Yep. So
Okay.
pretty
Oh,
pretty
interesting.
exciting stuff here. We just drafted our first grant proposal for that.
Oh, that's exciting. And so, and the gender nonconforming PTSD study, would that be individuals or is that also a group model?
That'll be individuals. Yeah.
Okay, great. Because that's another group that really has not been studied sufficiently
Yeah.
for this. So
Yeah.
that makes a lot of sense. And then the group study with the VA, so that's veterans with PTSD. So similar to the protocol that was used in the phase 3 MAP study, but instead putting them into a group. Are they going to be dosed together, or is this like the other study that Chris Stauffer was part of, where the HIV study, where people were dosed separately but had integration and preparation as a group? Do you know how they're going to do that?
I'm not particular on the details if they're being dosed during the group therapy or they're being dosed separately and then are doing preparation and integration as a group.
Okay. Wow, that's really exciting.
Yeah.
Yeah. And that seems to me like a great way to scale this work, because we talk a lot in Open Nurses about how nurses could really serve to resolve a lot of the therapist bottlenecks. But the other one that I think is, doesn't get talked about enough is, can we do this more in groups? Can we create community with this? So that sounds like that's what you're doing there. Fantastic. So what's your part in that? As a nurse, what are you doing in the lab? Walk us through a day of your lab life. What does that look like?
Yeah, sure. So I was very research naive. I had no research background coming into this. I just, as my wife likes to point out, was the right amount of annoying and just kept looking for unpaid research assistant positions um, within the lab, and multiple emails, and eventually was given the green light to participate. So I started as a research assistant
Okay.
and spent a year doing that, and just doing all the things that research assistants do, the odd jobs, running and getting lunches and typing up drafts and protocols and etc. Attending lots of meetings, supporting the therapists and the providers and the clinicians in their roles. um, and then after a year of being in there, I was offered the opportunity to become a trainee. So I'm working under the providers and clinical assessors to learn how to assess and make sure people are going to be appropriate candidates to participate for this.
Mhm.
I am MAPS trained. I went through the MDMA training with Annie and Michael Mithoffer through the
Mhm.
Bronx VA last year. So if there's an opportunity to become a facilitator and sit in a session, I'm trained and ready to do that too. But to be honest, I feel really called into the space of making sure that people are adequately screened and um, are have the likelihood of having the most safe outcome with these experiences. So looking into the clinical assessor role, and doing chart checks and background and
Mhm.
all of that, and making sure people are good candidates to be involved. Like I think that work is just so important to the success of these therapies and these medicines availability.
Right, right. Yeah. So for people that are unfamiliar with lab work, so the CRAs, clinical research assistants, sometimes called by different names, but they really are, and you can attest to this, Josiah, that in my lab they're really the glue that holds the whole thing together, because they're the people who usually when you call a study and say, "Hey, I heard about this study, I'm interested," that's the first person you're going to talk to. They're going to ask you some questions about your suitability. So it might be like there's a certain age range that the study is recruiting for, and if you're outside that range, that's sort of the end of the conversation. But you're also really talking about all the million little details that they do to make the study happen. And then once they get screened in, then your job, from what it sounds like, is to really make sure that they are appropriate for this study that we're
Mhm.
using, that we're not giving this to somebody who it might harm them for some reason. Um,
Yeah,
how
definitely.
do I'm curious because in my role in the lab, by the time they get to me, they've passed through all those hurdles. They've gone
Mhm.
through the pre-screening and so we're getting the people who are actually eligible when we're sitting down to start the study with them. So you obviously studies have more strict inclusion criteria, exclusion criteria than will probably be the case in clinical work. But when you have to tell people that, like, yeah, sorry, you can't be in this study, like, how do you do that?
Fortunately, I don't have to.
Ah,
So,
okay.
yeah, that's not part of my day-to-day role with the lab. Um, but people get told with the psilocybin study, it's randomized controlled trial. So some
Mhm,
people are randomly selected to treatment as usual, and
mhm.
they're told, sorry, you didn't get included to have the psilocybin for this. Um, but your role in this study is just as vital because we need that comparative data. Um, so fortunately, I don't have to bear the bad news, but Dr. Christopher has this ability to just attract the best people into his orbit, and so there's people that are very skilled in breaking that news to people.
Well, he found you. So clearly he's got skills for finding good people. Yeah, I do wonder about that. With all this sort of excitement and hype around psychedelics, we haven't really talked about the people for whom they're not going to be appropriate for whatever reason, whether that's their psychiatric condition or their cardiac condition or what have you. And then also, like, what do we do for people that it doesn't work for?
Mhm.
Because, we've sort of been talking about how this cures everything for everyone. And, those of us who do clinical work know that that's rarely the case, if ever. So yeah, I'm just wondering about that, and I suspect that nurses will also be in that role of like being with somebody when they get news that they don't want to hear.
Yeah.
That they're not going to be suitable for that treatment. You mentioned the MAPS training, and there's a few questions coming in about that. So how'd you get involved in that, and how was that something that nurses can readily do? Is there prerequisites? How did you get involved in doing the MAPS training?
So I was actually fortunate enough to get involved and do my training through the VA because I worked
Mhm.
at a VA. It was offered to VA employees and veteran adjacent providers or care providers. So the majority of people that I did my training with were VA employees. There were some people from the Cohen Foundation and
Okay.
some other veteran organizations. But the unfortunate thing is, I think MAPS is done. They don't have any cohorts scheduled for the MDMA training for a while, I believe. You'll have to
Okay.
don't quote me on that, but I'm pretty sure that that book is closed for a little bit, just because they have such an abundance of people that have gone through the training at this point.
Okay. Yeah, and I think they're making a full court press on trying to get this to the FDA, and it's
Mhm.
amazing what MAPS has pulled off with just a relatively small staff of people. When you think about that, getting a drug through FDA approval is usually, in the hundreds of millions of dollars, and an army of thousands of people working on it, that they've been able to pull this off with as small of a crew as they have. Um, so what I'm hearing, if somebody were to say to you, wow, Josiah, you're living my dream. I want to get into research. I want to be involved in psychedelic therapies. So what I'm really hearing is be persistent and annoying,
Mhm.
or just the right amount of persistently annoying. Um, Take a ground level position, even if that's doesn't require an RN. That being a research assistant would get your foot in the door, and then look for opportunities for training, and make yourself a sounds like make yourself a known entity is what you're sort of saying. So when you were already working in the SNAP lab, when you had the opportunity to move into that increased role of responsibility.
Yeah, definitely. I would definitely say that, if it's something that someone is interested in pursuing, it's just becoming increasingly popular within academic institutions for research and et cetera, where now it seems like if you don't have a psychedelic research program in your organization, then you're kind of old news. And so I think there will be a lot of opportunities for people to get in at the ground level, and just showing an interest, and being enthusiastic and curious goes a long way. People like that.
Yeah. Yeah, and I also know, from having known you for the last couple of years, that you are an excellent networker. That you really know how to engage with people, and to seek out those opportunities. And I think that's the other piece of advice that I would just the more people probably in this space, the better. Um, yeah, it's so funny that I'm thinking some of the questions that we traditionally ask in these interviews we wrote, when we started this series, like when it started with the pandemic about 3 years ago, right? And even then, there was still this tone of like, oh, is it okay to talk about psychedelics in kind of polite company at work?
Mhm.
Will that get you in trouble? Will that get you under scrutiny? And now it's almost flipped the other way. And of course, I'm in San Francisco, you're in Portland, so those are kind of hubs of this sort of stuff. But who'd have thought there'd be a day when not only do you want to talk about this stuff, but if you don't have a psychedelic research center at your institution, then you're going to look a little old fashioned.
Yeah, it's funny. I just did a project for one of my classes, and in one of our assigned texts, um, I think it's the PMH scope and standards book, but exciting new research opportunities in nursing. Both ketamine and psilocybin were listed in that required
Really?
text.
Okay.
Yeah, so
Okay.
um, yeah, I think times are a changing.
Well, when the nursing publications are saying that, then it's really caught up, right? Because our profession tends to lean a little more towards the conservative side when it comes to new therapies. And so you started, or at least have the brainchild, I think it's still kind of in formation, a community information organization in Oregon there with regards to psychedelics. Could you tell us a little bit about that, and how you envision the role of nurses in that organization when it gets launched?
Yeah, of course. So, you know, like everyone that comes into this space, I was just so excited to be a part of it, and how can I be contribute in a way that isn't doing something that's already been done a million times, or kind of just taking up space. And the biggest gap that I really started to identify was there's this there are these holes of community education, resource access for information, et cetera, on both the provider healthcare side, and then with the general population of people that are maybe psychedelic naive, or curious, or looking to um, gain access to legal services now. This is brand new. There haven't We haven't had legal access for these substances in 50 years. So
Mhm.
um, I came up with this idea along with Dr. Christopher and my good friend Brent Canode, who is the executive director of the Portland Alano Club, to create this kind of information container that could kind of be a bridge for people. A lot of times I hear providers say, I've got clients asking me about this, I don't know anything about it, I don't know where to get information about
Mhm.
it. You put a Google search in, you get a million responses. I don't know if it's good information, and I don't know where to send them.
Mhm.
And we get the flip side where you might be at dinner with some friends and they say, I think I want to have a psychedelic experience, but I don't know where to go to get that. So, there's this need to have kind of this container, this hub of information. And so we're in process. It's a slow moving process, but we're in the process of creating that organization.
And do you imagine nurses being some of the disseminators of that information to different community organizations and, speaker events and things like that?
Oh, they're at the top of the list.
Yeah.
Yeah, no, of course.
PTA meetings across the state, right?
Yeah, there's these conversations about creating, speaker bureaus
Mhm.
for psychedelics, and
Mhm.
again, to trumpet the amazing skill set that nurses have. This is our wheelhouse. This is what we are trained to do. We go and share information to the public
Mhm.
about various topics and subjects, and so psychedelics are no different. So with this organization, we'd love to have nurses involved. We'd love to have a team that we can have on speaker bureaus, so when there is an event that we need to go send people to, they're trained, they're aware of all of the information that needs to be shared, and they just go out and shine like we do.
Mhm. That would be great. I literally gave a talk to my kids' PTA a few weeks ago. It was a follow-up to a presentation that I'd given to the students called "How Drugs Work and How Not to Die Using Them," where we talked about overdose prevention and Narcan and fentanyl and drug interactions and things like that. And so, yeah, there's a huge interest in this. I would imagine that you will have no shortage of interest when that started. Does your organization have a website or a name or anything like that yet?
Yeah, so we're called PICO, Psychedelic Information Community Organizations. No website yet. We were kind of getting ready to get a bit of a rollout last fall, and then with the economy and the recession, philanthropic donations kind of were not available that we had hoped were going to be. So if anyone would love to donate to an up and coming organization, we'd love to put your money to good use, and a good cause.
Yeah, so they would find you through the Snap Lab at OHSU. Is that the best way to?
Yeah, I can leave my contact information. Our fiscal sponsor is Reconsider, so we're
Mhm.
going to be affiliated with that organization.
Okay.
I'm not sure how familiar with the audience is with them, but they're also doing just amazing work in this space and really, building some great bridges between different groups that are involved in the psychedelic space.
Yeah. It would also seem like it would be in the interest of the state of Oregon to to enlist your help in educating people. I would think, just if anybody at the psilocybin authority in Oregon is watching this, I'm thinking, I mean, the same way that like the Fireside Project, I know has
Mhm.
been in conversation with different communities about offering that resource to make that more readily available. Fireside, for people that aren't familiar, is a peer to peer hotline for anybody who's having a challenging psychedelic experience, or wants to talk about one that they've had or want to get information about one that they might have coming up. So in many ways, it sounds like you have uh, similar missions.
Yeah, definitely. The Oregon Health Authority is just so critically understaffed right now.
Uh,
For them to take on an endeavor like this to inform the state of Oregon, I think is a bit challenging. So it's going to kind of have to happen at the ground level and then go up.
Yeah, yeah,
And
and
there are a lot of nurses that are and people in Oregon that are interested in making that happen. It's just we need to
Mhm.
come together and get some funding.
Okay. And with regards to access to psilocybin there, so you have to be an Oregon resident to become a facilitator or open a center, but anybody in Oregon could go to a center, right? You don't have to be a resident to avail yourself of a psychedelic of psilocybin center.
Yeah, you can just come to Oregon and have a psilocybin experience. You don't have to be a citizen of Oregon.
Okay.
So what we are anticipating is that there will be, psychedelic tourism where people are coming in to Oregon to access legal psilocybin experiences, similar to what we see in Jamaica and Central and South America.
Right. Okay. Psilocybin without a passport.
Yep.
Okay. We should trademark that one. That's for the tourist board of Oregon. So I'm wondering if we have any questions from the audience from our. Let's see what pops up on the screen. This is where we check the magic 8 ball and see what happens if anything comes up on the screen. If otherwise, I've got more questions for you, but maybe. Oh, here we go. All right. So here's a good question. Well, what advice if I'm a baby nurse just starting out in my career and I've heard about psychedelics and I'm interested, what wisdom would you share? What should they be doing to prepare themselves for that and to learn about it?
Well, I think having a enthusiastic curiosity, trying personally, when I start getting interested in a subject, I just devour everything I can get my hands on: books, podcasts, conversations, etc. Just to really kind of start to understand and digest what's going on. I think with nurses, we do need to be mindful of that these are still federally illegal substances, and we are subject to review of licensing boards. So I'm very careful about what organizations that I'm willing to be involved with and endorse. I do not condone or suggest that people engage in illegal behaviors. And you know, use this opportunity with this changing landscape. It's so new that
Mhm.
someone that's interested in getting involved, there's so many opportunities to do so.
Yeah, and we've talked about this before, and I think I'm really glad you're bringing it up again. Is that with things like 109 in Oregon, it's very easy to make the mistake and say, well, it's legal, right? And I mean, really, it's more decriminalization, which is a subtle but important distinction, and it's still illegal federally,
Mhm.
right? And we all remember our civics class, right? What is it? The supremacy clause of the Constitution, right? That the federal laws can supersede state laws if they choose to enforce them. And in the early days of cannabis in California, the feds would routinely bust big cannabis operations and remind the cannabis growers that they were still breaking the law, breaking a federal law, even if they weren't, even if the state of California wasn't enforcing it. So, because that happened, you had an incident up there where somebody really kind of pushed the edges and opened up a mushroom shop in Portland, right? Like a cannabis dispensary, but for mushrooms, right?
Mhm.
What happened
Yeah,
there?
we had a very adventurous group of entrepreneurs that thought, well, we're just going to open basically a head shop for psilocybin and all things mushrooms, and they had advertisements on the street and a line going around the block every day they were open, and they got raided by the Drug Task Force of Portland, because that is not what was approved with Measure 109.
Yeah.
So
I guess there's always that part of the entrepreneurial enterprise that will ask for forgiveness rather than permission, right?
mhm.
Um, and so to be clear, that isn't something that's available there. You can't just go buy the stuff in a dispensary.
No, no, you cannot. You have to go and purchase a service from a service center with a facilitator.
Got it.
Yeah, there's no possession of a substance.
A psilocybin. I like that.
Yeah.
You just made up a new word there. There's a question about your study. Why are you guys using IV ketamine versus IM or lozenges in this in the methamphetamine study? Or not the? Sorry, I'm mixing things up. That's a depression study. Your methamphetamine study is different. That's yeah. So in that depression study, why the IV route?
The short answer is that's what the VA wants to do, and so that's what they do. I think it comes down to a cost um, uh, reasoning, where it just makes sense to give it IV and have them. We have on our at our hospital we have a TMS clinic
Mm-hmm.
as well, and so real similar where people can come in, they can have their service provided to them, and then they can either stay at the hospital or they'll likely just discharge in most
Okay.
cases and have someone take them home.
Okay, got it. I think we have time for one more question here, and then I've got my finale question for you from somebody with the interesting screen handle here. Vegetarians taste better. Um, no comment. What's the best, most affordable training for an RN that people would recognize if they want to get involved in psychedelic therapy? I'm assuming that they're saying, I'm not interested in some underground training, but to prepare for sort of above ground work like you're doing, especially if MAPS doesn't have training right now.
Yeah, I mean, I think that's a great question, and I think it's from a great way to get involved in this space and start to build community and network, et cetera. I think best and most affordable, that's kind of a value judgment of, if it's cheaper, does that make it better for you? Or if it's more of, do you want a, um, recognized, experienced organization? Andrew, I know you've been involved with CIIS. There's if you're in Oregon, there are several training facilities that are opening. Many of them are very good. I've met many of the people that are working as trainers at these service centers, and then I believe there are online cohorts too. So if you were to hop online and do a pretty rigorous search and see what meets your criteria, it would be pretty reasonable to say that you'll find something that you will meet your needs.
And Oregon actually certifies whether or not a training program meets their criteria for somebody to be a practitioner in Oregon, right?
Yes.
Am I understand that correctly? So that would be
Yeah.
something you'd want to ask about if you had any ambitions of coming to Oregon and doing this work. You'd want to ask, will this training prepare me for working in Oregon? Does it qualify? Because I know that there's certain programs that have that certification and others don't. So that's worth asking about. All right. Well, we're up against time here, so I want to ask you our last question, which we always ask people is, if you could go back in time and give your younger self a little bit of advice, what would it be?
It's worth it. Keep going.
Mm-hmm.
Like I alluded to earlier, I had some really difficult challenges as a young person, both growing up and then as a young adult. And I was able to, with the support of a lot of wonderful people and just their loving care, grow and learn and heal about myself, and then got into a position where, I could pursue nursing and pursue research and start to build a community and meet all these just incredible, passionate people such as yourself, and and Angela and Liz and Wendy and just all these other people that I've connected with in the psychedelic space these last years. So yeah, there were some rough patches in there, but this is just the happiest I've ever been in my life. So yeah, it was worth it.
Come for the psychedelics, stay for the people. That's what I say. You never meet a more interesting group of people than you do in the psychedelic space. So I sometimes forget that we're talking about drugs sometimes because the people are just so interesting, yourself included. So thank you for being part of our series. I'd like to think we're kind of making a little historic time capsule for the future, for future nurses, and for those of us who are nurses now. And so it's such a treat to have people come on here and share what they're doing. And I've heard from more than a few people that these interviews are really inspiring. We started this organization just 3 years ago, wanting to make sure that nurses knew that they not only could do this work, but they should do this work. And you're a great example of somebody who's walking that talk. So thanks for being on with us tonight, Josiah. And for those of you who are watching this at home, if there's friends that you didn't get a chance to watch it live tonight, it will be on our YouTube channel right after we're done here, so you can catch it on the replay. Thanks again, Josiah. Have a good night, and we'll be back next month with a colleague from Texas, Anna Osborne, who works as a ketamine nurse and a death doula. So stay tuned for that and keep an eye out for announcements to that effect. So look forward to seeing you next month. Thanks, Josiah. Good night.
Bye, everyone. Thank you.